Understanding feline hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy, or HCM, is the most common heart disease affecting cats. It consists of papillary muscle enlargement. The disease is genetic in cats such as the Maine Coon and Ragdoll, but it can also be a secondary condition as well. HCM is associated with left ventricle hypertrophy, or left ventricle filling. This doesn't mean that the heart enlarges within the chest cavity. What happens is that the muscles within the heart begin to take up chamber space and cause restricted output, which causes the blood to back up and create a saddle thrombus in some cats. The heart is enclosed within the pericardium, lying in the mediastinal space within the thoracic cavity, cranial to the diaphragm, medial to the lungs, and spans the 3rd to 6th intercostal space. HCM is a chronic condition that often presents itself as acute once the left ventricle heart muscle has thickened to the point of an acute cardiac arrest or pulmonary embolism. It is chronic due to the months of sometimes years that the heart continues to thicken over time. This is an echocardiogram of an HCM in a cat. You can see the thickening of the left atrium in this video, as well as the mitral valve is barely opening and that the walls are not touching at all, showing that the ejection fraction rate is low. These walls. Another thing that is noticeable here is that the smoke-like material forming, showing that there is a clot in the left ventricle. You can see the smoke coming out right here. An echocardiogram is the best way to diagnose hypertrophic cardiomyopathy. A score of 6 or higher in left ventricle wall thickness is the first sign of HCM. A vet trained in echo will then look at the ejection fraction as well to observe the blood flow. As the blood and oxygen to the body are depleted, outward physical signs will begin to show in the cat's behavior. Have you ever tried drinking a thick milkshake through a tiny straw? It really doesn't work that well, and your cheeks can get super tired from trying to pull the thick ice cream through the tiny hole. Now, if you were to use a straw, as they give you at the boba tea shop, that would work. That is what happens to blood vessels during vasoconstriction. They narrow to maintain blood pressure. When the heart is unable to pump oxygen and blood efficiently through the body, the sympathetic nervous system increases the heart rate, tachycardia, by releasing adrenaline to increase blood flow, causing a drop in oxygen levels. Some cats show no physical signs until the disease is advanced, and even then they may not show clinical signs until sudden death occurs due to left heart failure or stroke. Cats that are experiencing heart failure have tachycardia and can develop an abnormal heart rhythm that sounds like a galloping horse in the chest wall. There is not any treatment that can fix hypertrophic cardiomyopathy, but it can be managed if it is caught early on. A veterinarian can place the cat on beta blockers to slow the heart rate and or an ACE inhibitor to block fluid retaining and hormones. HCM is not a preventable disease, according to Dr. Gerald Bell, a veterinary geneticist. It is the most common cardiac condition in cats with a 10% prevalence, and it is fatal. So it requires attention on both the pet and veterinary medicine sides. With early detection, it can be managed, and responsible breeders of cats with a genetic mutation, such as the Maine Coon, can be educated to perform proper testing to remove cats that carry the precursor to the mutation and to prevent it from being passed to offspring. These are my sources and photo credits.